Hello, my name is Scott Regenbogen. I'm a colorectal surgeon at the University of Michigan, and welcome to the IBD School 400 series. In this video, IBD School 416, we will be talking about recovery after surgery for ulcerative colitis and Crohn's disease. In this video, we are talking about abdominal operations for Crohn's and colitis, usually involving removal and/or reconstruction of part of the bowel. These operations can be performed laparoscopically, making smaller incisions, or using traditional open surgery with a larger incision. Either way, bowel surgery is considered major surgery, requires full anesthesia, a stay in the hospital, and additional recovery time at home. Most people take 6 weeks off from work after surgery, although some go back to work sooner. Before surgery, things you'll want to think about. Your recovery will be smoother if you are as fit as possible before surgery. We recommend exercise such as walking or bike riding. We recommend a diet with plenty of protein before surgery, even if that requires taking protein supplements such as Ensure or Boost. We will also recommend you quit smoking and minimize alcohol before surgery, as these substances increase your risk for complications. Some patients will even be referred to our M-Shop, our preoperative fitness preparation program, where you'll learn some of the tricks of exercise, breathing, and diet. Most people come to the hospital on the day of surgery. You may need to do a bowel prep the day before surgery, much like you would for a colonoscopy. You will also have instructions for overnight carbohydrate loading, drinking energy-rich clear liquids to keep yourself hydrated, and you will be asked to shower with antibiotic soap. You will receive a printed day-by-day guide to your care after surgery. After your operation, you will go to a recovery room and then to a regular room. Most people will have a clear liquid diet after surgery, then food the next day if feeling well. Most people will have a bladder catheter and an IV drip for 1 or 2 days. How long people stay in the hospital varies a lot. Some are ready to go home in just 2 or 3 days, while others are in the hospital longer, depending on how long it takes to be able to keep food and drink down and have pain under good control. You can minimize how long you need to be hospitalized by walking and getting out of bed as much as possible, minimizing the use of narcotic pain medicines, and listening to your body and not eating or drinking more than it's ready for. In general, patients will transition from IV or epidural forms of pain medications to oral forms within a couple days of surgery, as they're able to keep liquids down. Most patients are given 3 types of medication for pain relief: Tylenol, NSAIDs such as Advil or ibuprofen, and narcotics. The narcotics slow gut function, so the other medications are intended to be used first, with the narcotic only as a backup. In the hospital, you will be expected to be out of bed multiple times a day as part of your recovery. This should start the day of surgery with getting up to a chair, and then progressing each day so you are doing multiple walks a day and eating meals out of bed. Being active will help you towards a faster recovery. You will be asked to use an incentive spirometer to help you breathe deeply. During general anesthesia, a machine breathes for you, and your lungs don't inflate as fully as when you breathe on your own. So after surgery, you need to re-inflate your lungs to keep them healthy. You will receive instructions on how to do this at least 10 times per hour. As far as your diet goes, you will begin with liquids and advance to a low residue diet within a day or 2, as long as you are doing well. If you experience nausea, vomiting, or distension of your abdomen, we will ask that you decrease your intake until that improves. After surgery, about 20% of patients experience what we call ileus, or slowing of the bowels, for some period of time that varies from one person to another. Once you're able to tolerate liquids and some food, your IV fluid will be stopped and your pain medications will be changed to oral form. If you need an ileostomy or colostomy, you may need to learn new skills about how to care for yourself. During your time in the hospital, you will gradually take increasing responsibility for the care of your ostomy. You will learn how to empty your bag, change your appliance, and measure your output. You should be able to perform these tasks reasonably independently before you go home. You can take over responsibility for these tasks in the hospital so you can practice and learn in an increasing fashion prior to going home. Complications after surgery can include wound infections or leaks. About 10 to 15% of patients experience a wound infection at the site of the operation, which may require opening the incision and letting it heal from the bottom up. If there is a leak from an intestinal connection, this can be a serious complication which may even require emergency surgery or even a temporary stoma to deal with that complication. Fortunately, this complication is far rarer. Patients generally stay in the hospital for 2 days to up to a week following colorectal surgery, unless complications arise before being discharged. At the time of discharge, you will be given lifting instructions, dietary instructions, and prescriptions for pain medications. If you have a new stoma, you will have guidelines and instructions for care. The medications you take at home may be altered after surgery. You'll be given phone numbers to call if you have concerns or problems. Most patients experience about 4 to 6 weeks of recovery before they are back to 100%. And can return to their work and perform their daily tasks as normal. After the operation, there are multiple steps along your pathway to recovery. For emergency surgery, recovery time may be longer, and the risk of complications may be higher than if the surgery was elective. If your surgery was laparoscopic, you may have a better chance of quick recovery and could be back to work up to 2 weeks earlier. In all cases, you will need to have acceptable pain control with oral medications, be able to move around, be able to eat and drink enough to avoid dehydration, and have good bowel function prior to leaving the hospital. If you'd like to learn more about the different types of colorectal surgery, please see our other IBD school videos on ostomies, the J-pouch, an overview of surgical options for IBD and ulcerative colitis. I'm Scott Regenbogen, and thank you for watching IBD School.